Hi, my name is Kahlan. I'm a third-year student nurse, and today I'm going to be demonstrating the administration of an IV med via a piggyback infusion. I'm going to start, just going to wash my hands quick, and I'm going to look at my bar to see my patient information. So my patient is Wrightson. Her FIN number is here. She's allergic to shellfish, and she has a history of congestive heart failure and diabetes, and her entrance diagnosis is pneumonia. So this has already been checked with the doctor's order, so I'm okay to put my med. So here, my patient is Wrightson again. The drug is Cloxacillin. I'm giving it 1 gram, and I have 2 grams in this vial. I'm giving it IV, and it says for IV infusion. I'm giving it every 6 hours or 9 o'clock, which is now, and I'm giving it via mini bag. So I'm going to look at my monograph here. So I have Cloxacillin. It's an antibiotic, so we're using it to treat their pneumonia. I can give it as a student nurse. The usual dose is 1 to 2 grams, and the max single dose is 3, so this is a safe dose. And it is compatible with D5W, normal saline, and normal saline is the primary running right now, so it is compatible. In order to reconstitute, my monograph says I need to add 6.8 mils of sterile water for an injection. So I have my sterile water here. Just going to take off the cap.
So I'm just going to get my mark, compare it to my physician's order to make sure everything was transcribed correctly, and it was.
I'm going to swab the top for 30 seconds and leave it dry for 15.
So I'm going to swab,
and then I'm going to attach my blood fill to my syringe.
Dry for 15.
Sterilely.
Same as my normal saline.
I'm going to pull back 6.8, and I'm using a 10 ml because it goes up by 0.2, and I can get my accurate measurement of that, and I'll inject my air.
She is allergic to pneumonia. So I'm just going to look at my parental monograph to see how this constitutes.
So I'm making sure I'm keeping watching for sterility. I don't touch anything.
And I will scoop.
Now I'm going to
just get out any bubbles and then recalibrate to get my 6.8.
So I need 1.8 normal saline. So I'm going to draw.
So I have that. Now I'm going to swab my med vial for 30 seconds. Leave it dry for 15 again. And inject my 6.8 sterile water. I'm also going to take out the air that I displaced to not create excess pressure in the vial. Right. Now I'm just going to mix it slowly. And I've also checked prior that this drug isn't expired. I would have done that during my first check. So that's all mixed. Now, so after reconstitution, the final volume is now 8 mLs. The final concentration is 250 milligrams per ml. So I have 1 gram or 1,000 milligrams ordered. So I need to pull 4 mLs according to my calculations that I did previously. So I'm going to pull back 4 mLs. I can use the same syringe because it's still sterile. And before injecting it, I'm going to re-swab because my hands might have touched it during mixing, and let that dry for 15. Now I can inject my air.
So to draw my right dose, I have to get out of this 2 ml. Inside this vial, I have to draw 1.2 ml to get my 150 mg.
Scoop that. Just going to get out any bubbles. Okay. So I have my 4 ml here. Look at that. 4 ml. Okie doke. Alright, so in order to dilute this and give it IV intermittent, according to my monograph, for a 1 gram dose, I can dilute it into 50 100 mLs of D5W or normal saline over 30 to 60 minutes. So since my patient has a history of CHF, I'm going to opt for the 50 ml versus the 100 ml just to reduce the chances of fluid overloading them. And since they're diabetic, I'm going to choose the normal saline because they don't need any more dextrose. And I'm going to choose to infuse it over 60 minutes versus 30 to prevent, again, fluid overload, and since they've got this drug for the first time, just to monitor for any side effects. Before I dilute it again, I'm going to do my second med check. So my patient is Wrightson. I have Cloxacillin here, Cloxacillin. The ordered dose is 1 gram, and I got that from this vial, which came to 4 mLs after reconstitution. I'm just going to check my calculations again. So yeah, I drew 4 ml, and we're giving it every 6 hours, which is now, and we're also giving it IV.
10 ml, 10 ml syringe. So I've already
So now I can dilute it in my PmHx back.
10 ml volume. I have to
Do my
use
swab.
8.8 ml of normal saline. So I'm going to
So
drop
I'm going
my
to swab the injection port for 30, leave it dry for 15, and then maintaining sterility, I'm going to inject my 4 ml.
Before I dilute,
Cloxacillin.
I'm going to do my second check.
Right, now I'm going to gently invert it to mix.
Hydrocortisone,
Now I can add my label.
Drug is
So here
hydrocortisone,
I wrote my
150
patient,
mg is equal to
Emma
1.2
Wrightson.
ml.
I have
IV
Cloxacillin,
is devolved.
the dose is 1 gram, the
24 hours
volume
is the
added
frequency,
to
and
the
time
mini
is
bag is
So I've
54
checked,
mLs.
then I'm going to
The
dilute.
concentration per ml, I can do the calculations here, is 1,000 milligrams, or 1 gram divided by 54 ml, the total concentration, and I get 18.5, so I have that written down.
I have my
And the date is
10
October
ml
16th, the time is 9 a.m., 0900, and I have my signature here. So this doesn't want to attach. I'm just gonna, okay. So now I'm good to go to the patient. I'm just gonna grab my IV tubing.
So I'm going to withdraw 8.8.
So when I enter the room, I'm just going to do a general safety check, which includes looking at my IV solution. So I have normal saline running at 30 ml per hour, which is correct. And there's no occlusions, everything's good. There's no signs of infiltration or phlebitis, infection at the IV site. Okay, so I'd introduce myself to the patient. Hi, Mrs. Wrightson. My name is Kahlan. I'm going to be your student nurse today. I'm going to be administering your IV medication, but first, can you tell me your first and last name, and your PIN number, and your birthday? Okay, and do you have any allergies? Okay, allergic to shellfish. Okay, so now I can just do my third med check. So I have Cloxacillin. I have 1 gram. We're giving it IV every 6 hours right now. Okay, so Cloxacillin, Mrs. Wrightson, is an antibiotic. Some side effects you can watch out for are nausea, vomiting, diarrhea, mouth sores, or gas. So if you experience any of those things, please let us know. Okay, so now
Okay, your first one was really good.
I can lower my primary.
Then I'm going to push it to the 8.8.
No, you're good, you're good. If that error happens again,
Then I have my.
ignore it. Ignore it.
I'm going to spike my mini bag.
Now I have it. I'm going to remove this so I can inject it.
Keeping the end sterile. And the clamp is down. So I'm going to grab another swab and attach it to the port above the pump because I want it to be regulated by the pump. I'm going to swab for 30 seconds. Now, keeping the hands sterile again. Going to connect it.
It's an antibiotic to treat her infection.
I'm going to push it to 10 ml.
And there's 5 milliliters.
Right. So I can unclamp, and I'm just going to lower it below the primary in order to get all the air bubbles out of my
I
tubing.
have my 10 ml. So I won't be taking this blunt fluid to my
So
patient.
once my
I have
air
to
bubbles are in and my
a
drip cord is filled about a third of the way, I can rehang it. And now I'm going to set my rate. So since I'm giving it over 1 hour to prevent fluid overload and to watch for signs and symptoms of a adverse reaction, I'm going to set it so the total volume is 54 mLs per hour. And the volume to be infused is also 54 mLs. Going to confirm and start that. So I'm going to watch for 3 drops. So I would see my 3 drops.
Bedside.
Okay.
I'm going to take my mom.
There we go.
My,
And now
tubing,
I'm just going to make sure I document. So the time is 0900 and my initials. Right, and I would do a general safety check again, checking all my lines, seeing that they're open, it's infusing properly at the right rate, I see
Entering
my
my
drip,
patient's room. I'm going
and I would also return afterwards to make sure that the primary is running properly after my infusion has finished. And yeah, that's about it. Thank you for watching.
Hello, my name is